every day deal with these multiple emergencies, multiple disasters all happening at the same time. He did it in a really calm way, no panic, no concern, and I was impressed. Have you ever wondered what it takes to become a brain surgeon? Today I'm going to take you through the path to becoming a neurosurgeon and all the challenges that we've all faced to come where we are today. Your path starts pretty much at high school, and it's a marathon, it's not a sprint. So a career in neurosurgery starts from a very dedicated, early trajectory into the sciences. You have to be focused in math, sciences, biology, chemistry in school, and then eventually choose a college with medicine in mind. So you have to choose a college where medicine is a priority. Obviously, your major is an important decision at that point. And then eventually, you'll be applying for a medical school spot, which is obviously extremely competitive. So a lot of things are required to get into medical school. And we can discuss all these in another video. But say you're into medical school now, right? Once you're in medical school, you need to be extremely dedicated and decided that you're going to go into neurosurgery. And why is that important? It's important because throughout these 4 years that you have an opportunity, A, to get a good education, but B, to get exposed to all the other principles of medicine, you should also be forging those relationships that will get you to become a neurosurgeon. Those relationships are very important. They'll give you, A, the opportunity to get letters of recommendation that then will be helpful to get you into the residency program of your dreams, and B, they will allow you to do research that will increase your visibility for these programs. Of course, you have to do well on your tests, and you have to do very well when it comes to standardized testing, right? USMLEs are very important, but truth be told, pretty much everybody that's competing to become a neurosurgeon will have very high test scores. So the things that are really going to set you apart are those connections, the letters of recommendations, and the publications. Say you did everything right, and now you are in your residency. Well, it might feel that the struggles are over, but in reality, the struggles are just beginning. So neurosurgery residency is one of the most intense residencies out there. And it lasts 7 years, so it's a big time commitment. So when most of your friends that are going to go into other fields of medicine, or even in other fields outside of medicine, will start working, making money, starting families, you will be starting your career by learning how to do neurosurgery. And that 7-year process is a really strenuous one. In the first year is what we call an internship. During your internship, you will learn general surgical principles, not necessarily all related to neurosurgery. Some will be critical care based, some will be management of neuro patients, either on the floor, in the operating room, in the emergency room. You'll learn about simple procedures like an external ventricular drain placement, an arterial line placement, a central line placement. Those all will be essential in your career down the line. And maybe the most important thing that you learn during your intern year is to recognize when somebody is sick and when somebody is not in need of your immediate attention. Because when it comes to neurosurgery, one of the most important skills is time management and understanding when there is an emergency that you need to intervene on immediately. I remember from my intern year, my first day of buddy call in neurosurgery. So I was an intern and I was taking call with this 5th-year resident, and a very seasoned guy, very skilled in what he was doing. And we're in the emergency room together, and we're down there because a post-operative patient that had gone home is back with bleeding in the area of the surgery, and he needed an external ventricular drain to decrease the pressure of fluid inside the brain. That's a surgical procedure that's done at the bedside, typically by the resident in programs that have obviously residents. And at the same time, the emergency room attending goes to the senior resident that was with me, and they're telling him, hey, listen, there is this trauma that just came in, bad head trauma that has a big subdural hematoma, blood collection on the surface of the brain that sounded like he needed surgery right away. And then at the same time, he gets a call from the ICU that one of the patients in the intensive care unit was showing signs of brain herniation, what we call the blown pupil. And so, he had to deal with three, seemingly to me, emergencies, all at the same time. For me, that was a great learning experience, because right at that moment, I just looked at him and saw what he was doing, and that allowed me to really understand how you prioritize. How do you decide with three seemingly dire emergencies? What do you do first? What do you do second? What do you do third? And of course, that day I was around, so he could utilize me, but I was not very useful. I was not very helpful. I didn't have the skills or the understanding to do anything other than run around and help him with small tasks. But at the end of the day, neurosurgery residents across the country every day deal with these multiple emergencies, multiple disasters, all happening at the same time. And he did it in a really calm way, no panic, no concern, and I was impressed. But that's something that you learn in that first year. You learn to understand what a real emergency is and how to prioritize. If you cannot prioritize, you cannot be in neurosurgery. And that's why neurosurgery residency has a really high rate of people not making it through. It used to be close to 30-35% of folks that enter neurosurgery did not finish the residency. So that's the first year. And then progressively from the second to the seventh year, you will be exposed to the surgeries. You will learn, you will hone in on your skills, with the culmination of this being your chief resident year as your seventh year resident, where you're able to do surgeries under less close supervision, fairly independently, be able to manage patients, run a service of other residents, and understanding kind of how things work, and that'll prepare you for the real world. In there, at some point in your training, there is time for research and development of your academic skills. That's typically a year or two. During this time, you might choose to do an enfolded fellowship, meaning do some subspecialized work in neurosurgery that then you can use to have a more subspecialized practice. That's definitely an option. But there is multiple things that you can do. Some folks might do an MBA during that time if they want to go into management or understand how kind of the business of medicine works. And in the future, we will do some videos on how you run a medical business and how you deal with payers and insurers and everything else. But certainly that's kind of what the outline is. Another important skill that you get, other than time management and prioritization in your neurosurgery residency, is you start to manage your sleep. And so neurosurgery is a field that has a lot of emergencies, and obviously for you to be able to perform at your highest level during those emergencies, you need to be in a mindset and overtraining that you can do that procedure or that surgery at any time, regardless of how tired you are or how much sleep you've gotten. And so, often, when you start your residency and you're on call and you lie down in the middle of the night and you get a phone call, first reaction is you're generally groggy. It takes a minute to really get your bearings and get out there and do what you need to do. But as the time goes by, and that happens in the most imperceptible way, you realize that you can go from 0 to 100. You can go from deep sleep to being fully ready to do a surgery in somebody's brain within a split second of your pager going off. And that training is invaluable. And that's why you spend all this time. That's why you spend 7 years. And often people equate neurosurgery training often to military training, right? So, you have, say, a special operations team that's asleep, and all of a sudden there's a need for a mission to be executed. Folks wake up and they go to high performance very quickly. But that doesn't happen overnight. Nobody's born being able to do that. That happens with training and persistence. And of course, at the end of the day, execution will always be good as long as you're very well trained. And those skills then you carry throughout your life, right? You do your residency, and then eventually you'll become an attending. And when you're an attending, those skills will be invaluable. It's a special field and we love it, but it also takes a special someone. You cannot decide to do neurosurgery for any reason other than being passionate about it. It's definitely a calling. If you're not passionate about it, at some point along the way, be it college, medical school, residency, fellowship, being an attending, you'll break. And then at that point, you would have wasted a significant amount of time. So only get into this field if you're passionate. Neurosurgery is not a 9-to-5 job. Neurosurgery is a lifelong commitment. And of course, you need to find ways to balance your family life and your work life, and more intertwine them rather than balance them. I guess my thought on that is, and of course, we're also going to do a video on that and kind of give some tips and pointers on how to achieve that. But in reality, this is, like I said, definitely a lifelong commitment when it comes to neurosurgery. And another point is that sometimes after residency, training is not done. If you want to go into a subspecialized field, right? If you want to go into fellowship, fellowships can be vascular neurosurgery, where you treat brain aneurysms and strokes. It can be spine, where you treat spinal conditions. It can be a brain tumor fellowship. It can be a functional fellowship, where you treat diseases like Parkinson's or epilepsy. It can be a pediatric fellowship, where you treat children with neurosurgical conditions. It can be a peripheral nerve fellowship, where you don't really treat so much the central nervous system problems, but the nerves of the rest of the body. And so many other subspecialties and fellowships that are out there. So if you make that decision, that's an additional time commitment that can range from 1 to 2 to 3 years in some cases, especially if your choice is to do multiple fellowships. If you were to ask me, I'm a neurosurgeon. I'm a fellowship trained neurosurgeon in endovascular neurosurgery and neurovascular critical care, and I wouldn't have had it any other way. But that's the mindset you need to have to get into this field. I'm grateful for the opportunities I've had, and I'm certainly, I would encourage anybody who has a passion for neurosurgery and the neurosciences to look into this field further and reach out to a mentor, engage, and good luck on your journey on that.
So I have a couple questions.
Yeah.
When you start residency, is it more of a generalized medicine practice, or is it neurosurgery from the start? And if so, at what point do you start subspecialty?
Yeah, so things have evolved over time. It used to be that for neurosurgery residency, you would do your intern year would be general surgery, which was not that relevant to neurosurgery. You would learn how to do some general surgery stuff, but those are not necessarily always pertinent. Managing bowel conditions or thoracic conditions really is not that pertinent to neurosurgery, so they modified that. So your first year, you belong to neurosurgery. That being said, you only spend a few months in neurosurgery. So the way it's structured, pretty much half the year is neurocritical care and neurosurgery. And the other half of the year is spent in general principles that can be helpful with neurosurgery. It's spent in principles like plastics or ENT, principles that then you will utilize, or you'd be tangential with, say, vascular surgery. You will work with these people, you will do procedures with these surgeons, you will collaboratively treat diseases. So they expose you to those areas early on. And then on your second year, and typically they structure the year so that the first 6 months are the general stuff that are more specific to neurosurgery, then neurocritical care and neurosurgery, and then you would transition into your second year being a junior neurosurgery resident and doing exclusively things that have to do with neurosurgery.
So if you are in a residency for any specialty and you discover that you want to change specialties, is that possible? And at what point is it not possible?
It's always possible, in life, you can do anything you want at any time, right? So it's always possible. So you can change your career path. It's just a tremendous time investment to get into some of those areas like neurosurgery, right? To get into neurosurgery, like I said, it's a path that you've started on very early on. You've started on that path sometimes as a high school student, deciding on colleges, deciding on other stuff. And so this tremendous time commitment, will have been done, and then you would have to switch gears and get into another field. You can always switch, and that's what happens with about 30% of the residents that decide that neurosurgery is not for them after they get into the field after they've been exposed to the hard training that it takes to become a neurosurgeon. And so folks then try to go sometimes into tangential residencies, right? They go, for example, for neurosurgery, they'd go into neurology, or they'd go into anesthesia, or maybe they go into pain management eventually. And so they, this is kind of the path that people would take. And yeah, so the answer is it's never too late. There's always an opportunity to change. It just becomes more and more challenging because of the time you spent there. And understand that, sometimes it's your decision to leave a residency. Sometimes it's the residency program's decision to not continue with you. You're not just a trainee. You're not just a student when it comes to a residency. You're a provider. You're a physician already under training to be a subspecialist. So you take care of humans. And so if the residency program deems that you're not safe, if they decide that your practice is not really done in a way that helps patients, then these patients belong to attendings who will very quickly not give you the autonomy you need, and eventually make a decision to not continue having you in the program. It is a privilege to be a resident. It's not a gift. And it does feel like we're entitled to be residents after we've put all this hard effort and this hard work and all these publications and everything else. But at the end of the day, you take care of humans, you take care of people that have families, that have loved ones, and they're not your test tube. They're not your training material. So training needs to be done in a way that does not really affect the outcomes of the patients. And so if you don't have the skill, if you don't have the ability to do that, make no mistake, the program will make a decision to move on without you.
So being a resident is a full-time job.
Oh, that's right.
And you had mentioned earlier about you're going to see friends and loved ones, or colleagues, maybe move on and start having a career. During your residency, because I think some people have a misconception that you're just in school for 7 years plus.
Right.
Is there any form of compensation means to live off of, or are you mindset of I'm just in school?
Right. So you're being paid, right? But you're paid minimum wage, if that. It's different in every state. Because the way this reimbursement is determined is based on the standard of living. So a resident in New York will be paid slightly more than a resident in New Hampshire. But if you adjust for standard of living, so compensation is similar. So it's not so much up to the hospital, but these are Medicare determined rates of reimbursement across the country. And so it's an extremely low pay, typically minimum wage. It's calculated on assuming 80 hours of work a week. There are new laws that govern, and they're not new anymore, but when I started my residency a long time ago, those were just starting to be implemented, but there's new laws that have to do with the length that you can work in a residency program. And generally speaking, residents cannot work more than 80 hours a week. There's more rules and regulations and granularity when it comes to that, and that came from concerns about safety of residents obviously being overworked. And there's also considerations when it comes to that of call, right? So you're not paid for call, you're not paid for consults, you're paid a standard salary. And in some programs, you'll take a lot of call. For example, if you're in a one person per year program, you have 7 residents, a PGY 1, 2, 3, 4, 5, 6, and 7. There'll be some times where you'll be on call every second night or every third night. Or there might be systems where you're on call every night for a week. And that way, you kind of have that routine figured out and then have other time off allotted. But at the end of the day, yes, you're in training, so you wouldn't really be demanding higher compensation. The compensation is intended to cover basic needs, and eventually, of course, you'll become an attending, and it's a different story.
Next question.
Yes.
Going through the path yourself,
Right.
and knowing what you know today, would you have changed anything?
I would not change a single thing. I enjoyed every part of it. I'll tell you, a misconception I had was that, every stage in my career will be easier. You're a resident, you think, well, I'll be a fellow and I'll have so many residents underneath me and it's gonna be so much easier. Wrong. I'll be an attending and then, I'll have so many house staff underneath me and I'll be able to do stuff. Wrong. Every change in your career becomes more challenging, more demanding. Responsibility is a lot higher in every stage of your career. The more advanced you get into your training, the more advanced you get into your career in medicine and neurosurgery, as far as I'm concerned, it becomes more and more challenging. But with that challenge comes greater reward. And there's no bigger reward than being able to take care of people and see them at their most vulnerable time, especially when it comes to neurosurgery, especially when it comes to vascular neurosurgery, and be able to change the course of disease in the most dramatic way and give people back to their families the way they were before they had a stroke, the way before they had a ruptured aneurysm. And I'm honored and blessed to be able to do that. I would not change a single thing. And I'm grateful for the opportunities this field has given me to professionally develop and personally develop and grow my family. I couldn't be happier.